Welcome to the Flint Community webinar on coronavirus. We are so glad that you are here, that you have joined us. This is the best place to be, whether you're watching us on YouTube or on Facebook, or if you're here live with us on Friday, August 26th. We're so glad that you're here. The webinar wouldn't be here without our wonderful partners that include support from the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Prevention Research Center. Billing in for your moderator, Yvonne Lewis. I'm Heather Lynn Uphold. I'm an assistant professor with Michigan State University. So excited to be here with you. And we have a great lineup for you. I want to acknowledge our wonderful partners who are here with us, Genesee Health Plan, so many others that are here to bring information to you and answer your questions. So if something's occurred to you during the week and you have a question about it, bring it to the webinar so that we can get it answered for you. I also want to remind everyone that this is the last Friday in August. August has been National Immunization Awareness Month, so we focused on that every Friday. And we want to just emphasize that immunization awareness is important, but also acting on that. Vaccines are an important part. They're one of the safest medical products available. They not only protect us, but they also protect others around us, and even folks who perhaps cannot get vaccinated. And, you know, we always think vaccination is for kids, making sure that the kids get back to school vaccines and all those sorts of things. But it's also for young adults and older adults and everyone in between. So make sure that you're up to date on your vaccinations. As I mentioned, we have a wonderful lineup for you today. We have Dr. Jeffery Johnston from Delta Dental. He's going to share some dental concerns and COVID and the impact of COVID on dentistry and the dental folks. We're also going to be getting an update from the Genesee County Health Department on monkeypox, so what you need to know. And then we'll be digging deeper with Dr. Susan Wolford and Dr. Lawrence Reynolds about the COVID guidelines. Those just came out a couple weeks ago, and we want to break it down for you so that you have all the information that you need. So I'm going to toss it to Jim Milanowski. He's a partner of ours. We love Jim. He's the president and CEO of the Genesee Health Plan, and he's going to introduce our next speaker.
Wonderful. Thank you, Heather Lynn. I'm excited. I feel like a roving reporter. We've taken this on the road, and I'm at Delta Dental outside of Lansing. And I am here, and before I introduce our speaker, I just want to make sure people are aware of a few things with the Genesee Health Plan. First of all, Genesee Health Plan does provide oral health coverage to the uninsured. So as a GHP member, people can get dental coverage through us. And we also provide coverage for two other populations, seniors. So seniors have Medicare, but they not always have a dental coverage. And so seniors can come to the health plan and get dental coverage. And also veterans. We think it's very shameful that our country doesn't provide dental coverage to veterans unless they have a service oral health disability. And so I really think it's important for us to cover those veterans, and people can do that at Genesee Health Plan. And so I know Corey Taylor, our dental coordinator, is on, and she can see your chat questions or any other questions. Feel free, there she is right there. So, if you have any questions about, coverage of oral health, please let her know, and she would be the resource for that. Corey and I also work together on a local oral health coalition that we host at Genesee Health Plan. And we meet on a quarterly basis, and it's a great opportunity for those who might be interested in oral health issues or want to address oral health issues. There's so many disparities, there's so many access issues that we get together as a group every quarter, and Corey facilitates. Dr. Johnston, who I'm going to be introducing in just a minute, actually participates in that. And if you're interested in that, we have Katie and Nurse T, and we have a lot of people that normally are on this webinar. And so I encourage you to join us and just let Corey know if you want to be invited to that. And then I've been on the Michigan Oral Health Coalition board for a number of years now, and I was elected president of that in July. And so that is, I don't know, if you're familiar with the Michigan Oral Health Coalition, it's an advocacy group, an association that really advocates for oral health issues and education in Michigan. There are big changes we hope coming in for Medicaid members. As Dr. Johnson knows, that's been an issue for many, many years. The reimbursement rates for Medicaid in our state, a lot of dentists have not wanted to take Medicaid in the past. It's not been worth the low reimbursement. I know Dr. Stewart, for instance, used to handle so many of the oral surgeries because no one else would take Medicaid. The state is looking to address those. And so the Michigan Oral Health Coalition and our partners like Delta and Michigan Dental Association are really addressing this with the state. And we're hoping to make some changes, and I'm hoping they'll come soon. So look for more information on that. But my biggest thing today was to introduce our guest speaker. I had heard him talk in May about COVID and how it impacted dental care. And we've talked a lot about different topics on our webinar, but we really haven't focused much on oral health. And so I thought it'd be important to do that. Dr. Johnson is a Senior Vice President and Chief Science Officer at Delta Dental. He also is an associate professor at University of Michigan. And, with me going on and on about oral health, you would think that I'm an oral health expert. Well, I'm reminded of that commercial where I'm not an oral health expert, but I stayed at a Holiday Inn Express. But I really have a good oral health expert for us to talk about this. So I'm going to turn things over to Dr. Johnson.
Thank you, Jim. Appreciate it. Thank you for attending today. And there's just nothing more exciting in my world than dental insurance. So we have the next slide, please. Just want to go over what's been going on with COVID over the last 2.5 years. I can't believe it's been 2.5 years that we've been dealing with this already. Let's just start by a basic understanding of what COVID-19 is. COVID-19, as you know, is caused by a virus called the SARS-CoV-2 virus. It first emerged in about December of 2019, but there's some pretty good evidence that was probably here as early as September of 2019. This is a virus, it's a coronavirus, and coronaviruses have been around for many, many years. This is nothing new. This is a special one that attaches to what's called the ACE2 receptors. ACE2 receptors are they're protein receptors that line our gastrointestinal tract, our nasopharynx, the nose, throat, and all that. The ACE receptors are responsible for a lot of different functions in our body, most notably inflammation and regulation of blood pressure. And they're found in many organs of the body. You're probably already familiar with what an ACE2 receptor is, because if you're over the age of 35 and have hypertension, you're probably taking a blood pressure medication that either inhibits or blocks these things. Medications like lisinopril or losartan, those are ARBs and angiotensin releasing agents, blocking agents. So this is nothing really new. We just never put names to it before. But since this protein is responsible for regulation of inflammation, and since this virus attaches to these and stops that function of that, that's why we start to see increased inflammation through our body and blood pressures are getting out of control. This is what's known as the cytokine storm, because as these chronic inflammatory mediators are released, they're released in such abundance that it causes a cascade of the inflammatory response. Have the next slide, please. So what are the symptoms of this? Well, they're pretty much related to whatever goes on in the GI and the nasopharynx. So you get typical flu-like symptoms, cough, fever, chills, those types of things. You also get dyspnea, which is a shortness of breath or difficulty breathing, because the ACE receptors are line the lungs as well. You get ageusia and nausea, which is a loss of taste, loss of smell, diarrhea, vomiting, and fatigue. because of all the pooping and puking that we've been doing with the coronavirus. And which is bad enough, but what gets serious about this is that it could lead to organ failure, and then eventually, as you know, unfortunately, a lot of deaths because of this, especially those with other medical comorbid factors. And then if that wasn't enough, then we have this long COVID, or the persistent COVID fog that really science doesn't know a whole lot about, other than it's not good to have. Next slide, please. So how do we get exposed to this? How do we catch coronavirus? Well, early on in the pandemic, it really wasn't known. Is it respiratory? Is it fomite? In other words, inanimate object touching surfaces and that. But now it's pretty much well agreed that the major vector of infection here is fine respiratory droplets. And I'm emphasizing very fine because this speaks to what masks are doing for us or not doing for us. Have the next slide, please. So when we look at our expired air, or when we're giving off these viruses, we have to understand how these particles work. So as soon as you sneeze or cough or even exhale or talk, we get these larger droplets of saliva, mucus, and these secretions. And these larger droplets generally fall off and hit the floor within about 4 to 6 feet. And that's why it became so important to advocate for social distancing, because if you can stay about 6 feet away from people, these larger particles just drop to the ground and are pretty much harmless. Where it starts to become problematic, though, is that as you get those finer particles, as the larger particles, the water evaporates from them, and it leaves these what are called droplet nuclei, the very fine particles, which are just the raw virus out there. Those don't fall to the ground very quickly. Those get suspended in the air, and that's what we breathe in and eventually get infected by the virus. So face shields and well-fitting masks, cloth masks and otherwise, do a very good job of blocking us from those very large particles. But unfortunately, they don't protect us from the fine droplets. And the only thing that can protect us from that are a well-fitting N95 respirator. Next slide, please. So let's do the math on masks. Why haven't masks been so effective at stopping this epidemic? Well, when you look at just the basic math here, the size of the coronavirus runs about 0.12 microns. The micron is 1/1000th of a millimeter. If you look at the spaces between a typical 200 thread count cloth mask, those spaces run anywhere between 5 to 200 microns, or let's just say on average about 100 microns. So when you're looking at a virus that's 0.12 microns, and you're looking at a space between the threads of a cloth mask of being about 100 microns, it's pretty hard to imagine that something that is 1,000 times bigger than the virus is actually going to stop the virus, which is why the cloth masks really don't work all that well. And the lycra masks are even worse because the distance between the threads of lycra is even larger. And the government very, very quick was they wanted to point to the efficacy of masks because of the scientific studies. And I just wonder how many people actually took the time to read those studies. On the state government website in Michigan, as soon as the pandemic started, or the epidemic started in Michigan, they cited 2 studies that showed the efficacy of masks, or why we should be using masks. But did anybody bother to read those studies? The first study was a study that looked at I believe it was a beautician somewhere in Virginia or something, and the patients or the customers that she cut hair on that wore masks had less coronavirus than those that didn't. And I thought, well, wait a minute, we've got a study with an N of 1 that's uncontrolled with no statistical analysis. That was hard to understand. And the second study had nothing to do with coronavirus or SARS for that matter. The second study looked at a testing method for masks. It didn't even have anything to do with infectious disease. But yeah, nobody bothered to read them, so they just said, oh, well, there's 2 citations, so let's start wearing masks. But when you do get down into the weeds with the scientific evidence on masks, I think a lot of them are misquoted for a bunch of reasons. A lot of the studies that are cited had nothing to do with viruses. They dealt with bacteria, and bacteria are 100 or more than 100 times the size of a virus. So maybe masks are stopping bacteria, but that has really nothing to do with viruses. The other flaw in these studies, or citing these studies, is that most of the studies on masks looked at 3 different variables. They looked at hand washing, social distancing, and masks. So when they were looking at the efficacy of masks, was it the mask, or was it the hand washing, or was it the social distancing, or was it all three? You can't tell from these studies. Another problem with these studies is, in most studies, they never defined what type of mask they were using. Was it an N95 that was fitted, an N95 that wasn't fitted, level 3 surgical, level 1 surgical, cloth mask, lycra mask? You don't know. So some of the studies that showed efficacy, some of the studies that didn't show efficacy, if you never define the mask, you really can't draw any conclusions from that. Another problem with masks is that most mask usage is improper. There's gaps in masks, and even N95 masks. The reason why 95 masks aren't working so well is they're not fitted. You know, I have to get fitted twice a year for masks for my N95 respirator. Once at University Hospital, it's mandatory for me to keep my job at the University of Michigan. I also work for the county of Oakland, for Oakland County, and I have to get fitted for an N95 respirator at the county. So I'm going through that twice a year. But most people, if not all people that are wearing N95s, aren't fitted for them, nor are they wearing them properly. The next slide, please. So what are the benefits of a mask? Well, you know, when you're looking at a cloth mask or lycra mask, I would liken this to asking, does a chain link fence actually stop mosquitoes? Well, kind of, maybe, but does, you know, that's not the question. The question is it going to stop you from getting the mosquito bite? And I very much doubt that. But there are some benefits of masks, though, and the benefits of masks are, number one, for me anyway, it was a reminder to keep my fingers out of my mouth and my nose. It also does stop the big droplets. So if you're sitting next to somebody in an airplane and they sneeze, I'd rather be wearing a cloth mask or lycra mask than no mask at all. Does it reduce the viral load? I think that remains to be answered definitively scientifically, possibly. But again, to me, the question is, does it prevent infection? And it makes a lot of people feel good. I'm sure you had the same experience as I had when the pandemic first hit. You know, I couldn't go to a gym, and my wife and I would go out for our walks in the morning, and people would cross the street to stay away from this. It was like we had a disease or something. So people just kind of got carried away with this stuff. But, I think we should be wearing masks for certain areas, but to say that masks are the answer to the pandemic, I think is rather short-sighted, as evidenced by the fact that we still are in a pandemic right now. Can I have the next slide, please? So the other problem is, have you seen how people are using masks out there? I mean, you know, I've seen masks worn like this or like this. Go ahead and start advancing the slide, please. Or maybe even how these other people are wearing masks here. So you're seeing all kinds of crazy ways that people are trying to wear masks out there. So without a proper mask and properly fitted N95 mask, maybe just a cloth or lycra mask, you know, I think it becomes pretty easy to understand why masks have failed to actually stop this pandemic. Next slide, please. For me, this is the most useful part of a mask here, is what's happening with gasoline prices. My goodness, it's hard to reconcile that. Next slide, please. So if, you know, for those that don't believe in the scientific method, that only believe in the lay media, then look at what the lay media is publishing right now. You know, when the Omicron variant came out earlier this year, even the government came out and said that the masks aren't working. And, you know, when the government even understands that, then you know that that's proof positive that these masks are very, very ineffective. Oh, but you know, it's the Omicron virus is different. Well, the Omicron variant is still the same coronavirus. The only difference are the antigenic determinants on the spike protein, but it's still the same virus. So if it didn't work for Omicron, what makes you think it works on the alpha and beta variants here? So I think everybody pretty much recognizes that the masks have been wholly ineffective at slowing down and preventing this disease. Next slide, please. So the government quickly came out, to their credit, with very good testing methods here. And again, these testing methods aren't anything new, but they were able to get testing out very quickly to the population. The gold standard for testing is molecular PCR tests. And you know, I've taken probably 90 to 100 PCR tests over the last 2.5 years. But what they do is they look for the viral RNA. And, it's very effective at picking up the virus. It's got the least amount of false positives and false negatives. The antigen test, on the other hand, is open to question, because the antigen test has been shown to be a little bit unreliable, not because of the test itself, but when you look at the antigen test, it relies on the patient being infected having the virus replicate and having enough antigen for the test to actually pick up. So the problem is they just don't really form enough antigen for this test to pick up within the first 2 to 3 days. So this is giving people a lot of false sense of security, because you get the sniffles, you take an antigen test, it's like, oh, well, I'm negative, I'm okay. But you're not really sick enough yet to start throwing off enough antigens. So you think you're okay, so you're out there without your mask, without all the precautions, universal precautions, and you may be infecting people unknowingly. So I question the value of these rapid antigen tests. The newest one is the rapid molecular test, but I don't think there's enough evidence to show what the efficacy or the effectiveness of that test is. Next slide, please. So these are the variants as of last month here, when it first came out with the Alpha variant, and the Beta, then the Gamma, Delta, and now we're in Omicron, and we're at the BA.5 variant the last time I checked. And this just follows the natural history of what viruses do. Viruses naturally mutate. If you want to put it in anthropomorphic terms, it mutates so the host can't recognize it, kill it. I tend not to put anthropomorphic terms on viruses, because we don't know if they're actually live things or not. But the fact is they do mutate in order to evade our immune systems. And one good thing, you look at the natural history of viruses, they tend to mutate to less virulent strains as time goes on, which is what we're seeing with the Omicron variant right now. Next, please. So the Omicron variant, which is the predominant variant right now, was first identified. It's actually first identified in Botswana, but they were actually able to trace it back to the first appeared in the Netherlands, and it has been the predominant strain in the United States since January. It's been noted that the symptoms of the Omicron infection are milder than the Alpha or the Beta, and for most people, you don't get the loss of taste or loss of smell. One thing we have noted, though, that there's much lower rates of hospitalization and lower rates of death than in the original variants. But one thing that is noted about the Omicron variant, it's highly transmissible, much more transmissible than the original variant. And right now, they've identified over 50 mutations for Omicron. And next slide, please.
I can't. There.
Okay. Before we get into the effectiveness of the Omicron, we have to just get a little lesson on the immune system here. The immune system is actually divided into 2 different systems. One is called the humoral, the other is the cell-mediated. The humoral is what we mainly talk about antigens activating B cells, and the B cells eventually create the antibodies which fight off infection. But there's another arm to the immune system that's called cell-mediated immunity, where certain cells like macrophages are activated, and then these cells actually migrate over to the antigens or the viruses or bacteria and gobble up or lyophilize the viruses. So we actually have 2 arms to this. So can I have the next slide, please? So when we start to look at why Omicron is doing what it's doing, the question is, why are Omicron symptoms less severe, and does the vaccine protect us from Omicron? Well, the answer is, next slide, please. It's yes and no. Yes, in the sense that symptoms are less severe, and the vaccine does protect us somewhat, but not in the usual manner. Have the next slide, please. So, no, with respect to antibodies, because the Omicron spike protein antigen is vastly different than in the original variant. So, the vaccine that we took for the Alpha and Beta and Delta doesn't necessarily protect us. However, next slide, please. But remember, since we have those vaccines in place, we've activated our cellular immunity. So we do have T memory cells and T killer cells out there that remember that we have had the virus before. So it's thought that it's probably the cellular immunity that's ramping up because of the vaccine we took that's stopping us from having the severe symptoms. Next, please. Also, with the natural history of virus mutations, they tend to get less and less severe over time. So probably the combination of that, plus the fact that we already have some memory cells that are protecting us from this. Next, please. So what's been the impact of COVID-19 on dentistry? It's had a tremendous impact on dentistry, as you may have found out if you visited a dentist within the last 2 years. Next slide, please. So the first thing that you notice when you go into a dentist is it's like walking into an astronaut museum here. We're wearing more disposable gowns, face shields, N95 masks. Now, dentistry has always worn some of these things for certain procedures, but now they're being worn for even more procedures. Early on in the pandemic, there was more social distancing being done. They were not allowing patients in the waiting room, but they would just text you out in the parking lot, and then you would come in, have your appointment, and then they would leave more time between patients to let the HEPA filters clear the room air. Some of the dentists actually have gone to negative pressure rooms to clear the air faster, because when we have aerosol producing procedures, like when a drill or a handpiece is being used, we're getting all that saliva and blood spewed into the air, so it's a very highly infectious environment. So you want to be able to clear that out. The good news is HEPA filters are extremely effective at removing these particles from the air. Also, dentists are using more isolate systems. Isolate systems are they've been around for many years. They have a light on it that lights up your oral cavity, but they also have a very high volume evacuations. So before the saliva and blood can be aerosolized, it gets sucked up a lot faster. And I don't know how many dentists are using rubber dams. I used rubber dams when I was in general practice, but for certain procedures like exodontia or periodontal surgery, you can't use a rubber dam. But dentists are doing what they need to do in order to protect their patients and protect themselves. Next slide, please. But let's look at some unrealized facts about dentistry. Except for when infection protocols haven't been followed, dentistry has never been implicated as a vector for infectious or communicable disease. It's an important point, so I think that bears repeating. Dentistry has never been implicated as a vector for infectious disease. Dentists in our entire history have been experts at infection control. In fact, I would argue that a dentist office outside of an operating room is probably the cleanest healthcare environment you can go to, because we routinely have been disinfecting our operatories and instruments and sterilizing our instruments since the beginning of time. We have a lot of experience with infectious disease. We've been routinely dealing with influenza, herpes simplex, HIV, H1N1, Legionnaire disease, SARS, HPV, even the cooties. We've been dealing with it all over our time. And by the way, dental hygienists and dentists have the lowest rate of COVID of any healthcare professional. Why do you think that is? Well, it's because PPE is effective and we believe in PPE. Another unrealized fact that often gets overlooked is there are consequences to delaying treatment. Unlike delaying your trip to your local restaurant, that cavity you have is not getting smaller, and that gum disease does not cure itself. And when we do oral exams, those early cancers may be not early cancers by the time we see it. So, the WHO, which I know is a very controversial group, but I'll save my comments to later on that. They came out and said, well, you shouldn't go to the dentist. The American Dental Association was quick to point out, well, excuse me, you have no evidence to show that it's not safe to go to the dentist. Plus, what about all the untreated disease that's going on? And it took about a day for them to retract that statement. But I guess that's the problem you have when you have a PhD running the WHO that doesn't know anything about dentistry. Next, please. So that kind of concludes my comments on what's been going on in dentistry, but I just wanted to finish by saying it is safe to go to the dentist. We should not be avoiding our appointments. Get vaccinated. That's the most important thing you can do to protect yourself. Wash your hands, social distancing. If you're going to be around people, put a mask on. And with that, I'll entertain any questions. Thank you for your time today.
All wonderful information. Thank you so much for coming and joining and sharing with us, Dr. Johnston, and to Jim for identifying this as a need, an area that we needed to learn more about. Dr. Reynolds has been posting in the queue or in the chat that he wanted to share our Swiss cheese model and make a couple comments. So Dr. Reynolds.
Oh, yes, I would emphasize that no one method of protection is perfect, that we must use multiple layers of protection in a community setting. And I will add I did not hesitate going to see my dentist because I understood that the procedures and practices that occurred within that office were optimal for reducing the risk of infection. However, when we're out and about in the community, you'll see as this loads showing layers of protection, vaccination is still the fundamental method of reducing complications from infection because of it will start an antibody response. And as Dr. Johnston said, it will stimulate the T cells. So there will be some reaction to infection. But once again, no layer of protection is 100% effective. And that's why we have therapeutics that are appropriate for some people, like Paxlovid. Then the next layer of protection would be isolation and quarantine when appropriate. And quarantine is when you have a question, am I infected? Or you've been in contact with someone who's been infected. Isolation is for when you have been infected. And I would still recommend wearing a mask. And our speaker did have to concede that perhaps it will keep your hands out of your face. It will reduce the spread of big droplets. And that's an important consideration, especially for around children. So, and then the most important thing, next important thing is providing testing, vaccines, and accurate messaging. Now, then there's another shared responsibility, and that's probably more evident in a surgical suite and especially in a dental office, and that is indoor ventilation and air filtration. But in a community setting, when you're visiting someone's house, you may want to leave your thermostat on. There's a constant setting for fan that will keep the air circulating. And if you have a good filter, will filter that air. And ideally, when you're around a large crowd, perhaps outdoors is best. Then there's testing. Now, contact tracing in a pandemic, it's too late. So we have to use these layers of protection. I would also encourage people to avoid crowds, especially with people you don't know who are unmasked. And sometimes I have to add relatives who you do know, who you know aren't doing anything to limit the spread of COVID. And that goes back to masks again. Avoid touching your face. The next layer is washing your hands when you cover your cough and sneeze, and wearing a mask over the mouth and nose. And yes, there's been a lot of discussion about what mask, and they say a high quality mask. And that is challenging, but the goal is to also reduce spreading other things that will cause someone to have to seek care in a group or crowded setting where they may get exposed once again. And then physical distancing, well, that means basically avoid crowds and crowded situations. And if you're sick, stay home. And what do we mean if you're sick? Yes, the signs of COVID are common to many common health conditions. But if you have cough, shortness of breath or difficulty breathing, fever or chills, muscle or body aches, vomiting or diarrhea, or a new loss of your sense of taste or smell, those are your signs. And to that list, we've had to add sore throat, headache. So those are the signs you look for. Now, when you need emergency care, those signs will be you have trouble breathing, you're breathing rapidly, you have persistent pain or pressure in the chest, you have new confusion, you can't remember anything, you don't know where you are, inability to wake or stay awake. And if you notice someone or yourself with pale, gray, or blue colored skin, lips or nail beds, and you need emergency care. So these are the signs of trouble where you should seek emergency care. And the clearest thing would be trouble breathing, chest pain, new confusion, can't stay awake, or significant changes in your skin color or your nail beds. So next, perhaps we should move on to the latest CDC guidelines, and I believe my colleague is online.
You're keeping us going, Dr. Reynolds. Thank you so much. This was wonderful reminders. Before we move on, I do want to just point out, Dr. Johnston, we have some questions in the Q&A for you. So if you can respond to those, we'll also try to loop back and do them live. If we don't have time, we'll bring you those answers next week. But we are going to dig a little bit deeper into COVID guidelines with Dr. Wolford and Dr. Reynolds.
Thank you so much, Heatherlyn, for this opportunity to dig deeper into the topic that Dr. Reynolds just introduced. So this week, I was putting together a desk, and I don't know how many of you do this, but when you try and put things together at home by yourself, or fortunately, my husband was helping me, I was helping him, lots and lots of instructions that you have to follow pretty much to the T. Otherwise, you don't end up with what you want. You know how I like to have my cooking examples? This gets us to recipes. Certain things you really need to do pretty close to the instructions. Otherwise, rather than a souffle, you get a soufflop. So you want to follow those instructions. And as was mentioned, the CDC came out this month, earlier this month, with more instructions about what we should do regarding testing and isolation and quarantine for COVID. And so we're going to dig deeper into that right now with Dr. Reynolds, if we want to spotlight Dr. Reynolds as well. And so we want to walk through these because they're pretty detailed and we need to know specifically what we should do in each circumstance. So Dr. Reynolds, thank you so much for going through those layers of protection. I should also say thank you to Dr. Johnston for providing information about what happens in the dental setting, and thank you to Dr. Reynolds for adding into that what's happening and what we should do in the community setting. So with that in mind, we'd like to know if you are exposed to somebody who has COVID, what should we do? And while we're bringing Dr. Reynolds in to answer those questions, please feel free to add your questions to the Q&A. We'll try to include those as well, should time allow. Dr. Reynolds?
Oh, yes. According to the latest CDC guidelines that were released August 11th, they are now recommending, instead of quarantining if you've been exposed to COVID-19, you wear a high quality mask for 10 days and get tested on day 5. Now, if you have symptoms between that contact or that concern and day 5, you should get tested. If it's negative, you should repeat that test in 48 hours. And sometimes they recommend even up to 5 days out, you test again. And yes, no test is 100% accurate, but they found repeated tests are 93% accurate. So once again, we don't live in a perfect world. We're learning something new about COVID every week. And it serves well to check with the CDC updates, or your state health department updates, or your county health department updates, so that you know about what's going on exactly in our county and in the area. And I will say, and I'm sure someone from the health department will go into more detail, we are at a high transmission period now. So over the last 3 to 4 weeks, we've moved from low to medium to high. We have more than 200 cases weekly. So please consider that. Okay, so we talked about what you should do for if you've been in contact instead of quarantining.
So I just want to jump in there for a second. Thank you so much for pointing out the high levels at the moment, because that means that one is more likely to come in contact with COVID than one would have been a few weeks ago. So it's important to know what to do. You mentioned there a fair amount about testing. Can you share just a little bit about where we can get the tests, and do they expire? And if they expire, how can we tell?
Yes. First of all, you can get tests from the Greater Flint Health Coalition, my organization. Just call this number 953-2427. 953-2427. You can get tested at the health department. You can get tested at the 3 sites that we have in the city of Flint. Just check the health department website. And if you don't know, ask your physician, ask the health department, but these things are posted. So that's important. And then the other issue is, if you are positive and you need cleaning supplies, you can call that same number and they will be delivered.
Can you
Okay?
say that again? Somebody will deliver me cleaning supplies?
Yes, if you test positive or someone in your household tests positive and you need cleaning supplies so you can appropriately do isolation, call the same number at the Greater Flint Health Coalition, 953-2427.
That's phenomenal. All right. So talk
Oh.
about local.
I forgot expiration dates.
Yes.
Always check the back of your box. Sometimes it's on the back of the box, sometimes it's on the side of the box. It will give you the lot number and the expiration date. And I've already had tests that have expired. Now, what we have learned as this has progressed is the tests are still good, but unfortunately, you either need to get a new test, which is probably the easiest course, or get on the CDC or FDA website and find out if they have extended the validity of that test for another period of time. You have to know the brand name and the lot number in order to do that. And all that only applies to if your test has expired. So you don't want to buy expired tests when you go to the store. And you really don't want to walk out of a place with expired tests. You want to check the dates. And look, I wear bifocals, but I have to use my phone, take a picture of the expiration date and blow it up so I can be exactly sure what I'm looking at.
I'm not the only one who does that then. I'm constantly having to take things with my phone and blow it up. Yes. Excellent. So we know what to do now about to look for whether it's expired or not. If you test positive, then and you need cleaning supplies, those can be provided by calling the number that is in the chat. But then what else should you do? If you're positive, how long should you isolate?
Okay. If you're positive, they're now saying isolate for at least 5 days. But there's a qualifier there. If you're symptom-free, no fever on day 5, and it's more than 24 hours since you've taken something for fever, yes, at day 5. Now, I'm still one who would put on a mask because it does not mean you're virus-free. And especially if you're around someone who's immunosuppressed. I would put on a mask, okay? Because we're talking about a community health setting, okay? So that would be the first recommendation. Now, here's the other thing. If symptoms return during that I would extend it to 14-day period, test again. And if you are positive, you got to start all over again. Unfortunately, that's the way it is. And you also have to be careful because you can have mild symptoms, mild disease, sore throat, headache, maybe a fever. But if you have rapid breathing, chest pain, those things I covered earlier, if your nail beds, instead of being pinkish, are turning dark, a darker color, bluish, you really need to seek emergency care. Okay?
Absolutely. Thank you so much for covering that. We have one question in the chat that we don't have a lot of time left for this section, but we have a question here. It says, should people change their behavior when community transmission is high? And if so, how? I thought you would love that question.
Yes. Now, when you look at changing your behavior, you have to look at your age. Okay, sometimes us in the over 60, 65 age group have to be more careful. Sometimes those of us in the community who are under 65 but have contact with elders or people who are immunocompromised, we have to be extra careful. So if you're sick and you still don't know the cause, you don't go out into a crowded situation, be it a social situation, even the church, a funeral, a wedding, where there's going to be crowds of people. You should really lay back and see how things develop with testing and fever over at least the next 48 hours. And ideally, perhaps it's not a good time to travel or do a lot of other things. Even up to 5 days. And I know it's a pain in the neck, but you don't want to potentially spread whatever that condition is, because yes, we still have bacteria and viruses, other viruses, okay? In a time of high transmission, I would be definitely careful about crowds. Make sure you're in a well-ventilated place, and that means open the window and make sure the fan is blowing out, not in. I would have families stay together. So in other words, people from one household, if they're out because they're well in a social situation, they stay as a group and kind of keep a distance from another household, because we don't know what's going on in our neighbors, friends, and families' household, or fellow believers, or co-workers, if that's the case.
Thank you so much, Dr. Reynolds, for answering those questions and allowing us to look more closely, to dig deeper into this information from the CDC. If you have any more questions about it, please put it in the chat. We will keep trying to answer them, definitely, if not today, during the webinar, in future weeks. And the link has been put in the chat for the CDC recommendations. Now, they have an excellent grid that shows, based on whether you're high, moderate, or low spread at that time, then our transmission at that time, what you should do. So do check that out as well, and send in your questions to us for us to dig deeper into these topics in upcoming weeks. Thanks so much, Dr. Reynolds.
Before we go, Dr. Walford, people say, well, what are the medical conditions and immunocompromise and weakened immune state? There is a 9-page document that lists these conditions in alphabetical order on the CDC website. So if you have that question, please check it out.
All right, so you heard it from Dr. Reynolds there. Check out that website. And then if you have questions about that, come back to us, ask your doctor, go find a trusted source of information to get more details. And we're happy to be that trusted source of information. All right, time has run out for our segment. We are going to hand over to Heatherlyn. Thank you so much, Heatherlyn.
And what a wonderful conversation it was. I'm going to try to squeeze in a question that we got in the Q&A for Dr. Johnston. So we'll have to be careful of timing here, but I think it's really important. It's a two-part question. The first is, if a patient has COVID, is there a specific way to clean dental equipment to prevent reinfection? Second part is, if clients have dry mouth symptoms after having COVID, what can you do about it?
Yeah, unfortunately, the virus is very labile, and it responds very well to inactivation by alcohol, soap and water, or just by desiccation, by drying out. I think most of the evidence that I'm reading out there is that fomite transmission is not a real big feature of this, and it was inanimate object transmission. So if you're cleaning like a mouth guard or a bite splint, those types of things, I would just clean it with like regular soap and water. rinse it off thoroughly, and maybe just douse it with a little bit of alcohol. It won't hurt the methacrylate resin that it's made out of. The second question is, if you have dry mouth, and this is a huge problem in dentistry. There are some preparations called biotine, and there's biotine is they've got some enzymes in. I think it's lactoferridase and polygalactonase, which are salivary gland stimulators. You swish, hold it in your mouth for a minute, let those soak into the mucous membranes. It will actually stimulate salivary flow. And for more extreme cases, you can get a prescription from your dentist or from your physician for a drug called pilocarpine. It goes by the trade name of Saligan. It's very effective at turning on the juices in your mouth, but it turns on juices everywhere else. It makes you sweat more. There's a lot of side effects to that, so I would only do that under advice of a physician.
Good to know. And thanks for sharing the issue with the possible side effects. It would be not so fun to walk into that not knowing that that was something that you might be experiencing. If you have any other questions, put it in the Q&A so that Dr. Johnston can get them answered for you. We're going to keep this moving and head to an update from Dr. Sadler about COVID numbers. So Dr. Sadler, where are we at and what's going on?
Yeah, so as usual, I guess has become the case, and fortunately, we are not seeing racial or geographic disparities between Flint and Genesee County or among white versus African-American populations or among other populations. So that's good. We're also seeing a slight decrease within the county. Again, it's just a 1-week decrease, so we have to keep our eyes on that. If you look back 4 or 5 months or so, it's kind of just been simmering around here, and we are actually in the CDC's high transmission level designation at the moment. So we have to keep that in mind. And just to zoom out real quick, and I probably said about the same thing a couple of weeks ago when I was last here, that nationwide rates remain the highest in the Southeast, and in particular hospitalizations and deaths still remain the worst in some of the least vaccinated states in the Southeast, ranging from West Virginia kind of in an arc down toward Florida. So that's what I've got.
All right, thanks for that update, Dr. Sadler. We're going to head on to Ashley Herbig from the Genesee County Health Department. Ashley, where should we go for vaccines?
So this upcoming week, we do have one of our brick and mortar sites, Central Church of the Nazarene, on Wednesday. That is 6 months and up vaccination for COVID-19. So if you do have your littles and you are out and about that day and you're looking for vaccination, that's where you'll find us. We also have a pop-up clinic at U of M Flint. The details are still being solidified, but those should be uploaded more than likely by the end of the day today on our website at gchd.us. It'll be the same vibe as a health fair. We will have health educators on site that will be able to answer any questions that you have for any public health scenario that you may be experiencing. We do have education on MPV or monkeypox virus, as well as COVID-19. So we are armed and ready for any questions you may have. Also on Tuesday, our partner Michigan United will be having a pop-up clinic at the Davison Farmers Market. Again, additional information can be found on our website at gchd.us.
All right, always good to have those resources. Thanks so much, Ashley.
Absolutely.
We're gonna move on to soon to be Dr. Kaylee Blaney. She's gonna give us our monkeypox update. We've got some slides to go through and then a quick update about Genesee County from her.
Hi, everyone. I will try and be quick to be respectful of everybody's time, but I did want to give a little update on monkeypox just because that is becoming the topic of the day. So we'll go ahead and go to the next slide. So the really telltale symptom of monkeypox is the rash. So that really is the big ticket item to keep an eye out for. They look different on different people. They're not always consistent, but they look like pimples or blisters typically. So if this is something that you get that is in a body part that is uncommon for you or is new onset, that would be an indication probably to go visit your healthcare provider just to get that checked out. One of the most important things you can do for infection prevention is let your provider know what you're coming in for ahead of time to make sure that not only are they protecting the other people that are in the waiting room, but that their staff is also prepared and protected when they come in to evaluate you. Sometimes other symptoms do show up first, things like fever, chills, swollen lymph nodes. So if you were exposed to monkeypox, it's not a bad idea to get testing at that point. Don't wait for those blisters or sores to show up. You can go to most primary care offices to get evaluated. Urgent cares are evaluating. You can also call the health department for an appointment to be evaluated as well. If you do test positive for monkeypox, just like there is now an antiviral available for COVID, there is an antiviral for monkeypox. That's something that you and your doctor can evaluate to determine if that's right for you. They'll take things like a medical history and ask you questions about medications you're on to make sure that there are no contraindications about your personal medical history that would make it not safe for you to take the antiviral. Additionally, and these are things that, we should be doing with COVID, be doing with all illnesses. If you're not feeling well, stay home, stay away from others. Sometimes it's just a cold, it'll go away quickly. Sometimes it might be something else. Specifically with monkeypox, skin to skin contact is the most common and easiest way to get monkeypox. But you also can get monkeypox from contact with bodily fluids. So it's important to make sure that we're washing our hands with soap and water or using hand sanitizer as much as possible. And I do want to add the added caveat that unlike a lot of sexually transmitted infections, monkeypox is not only a sexually transmitted infection, which means that condoms aren't always effective at preventing monkeypox, because contrary to what some might think, monkeypox is a disease that could affect everyone. It's not specifically an STI. It is a skin-to-skin contact outside of sexual contact transmission illness. Another bit of information to talk about is if you do have someone in your household who has monkeypox, again, this is not just a sexually transmitted infection. This is something that contact with an individual at a household level with monkeypox. You could also yourself get monkeypox. You could also get monkeypox from items such as linen, clothing, towels. To go way back in history, if you remember back with your history lessons, one of the ways that settlers infected Native Americans with smallpox was by giving them blankets of people who had died of smallpox. So the transmission is very similar to that. It can be transmitted by inanimate objects. So it's important to, if you have a case of monkeypox in the home, all you have to do is wash those linens. The heat of washing those linens in hot water will kill the virus. Don't share towels, don't share toothbrushes, don't share personal items like razors, things like that. And when you're in your home, if you have someone who has monkeypox, and maybe it's a child, maybe it's an elderly individual, make sure that both of you are clothed as much as possible to prevent contact with those sores. One thing I did want to mention, I know we're running low on time, so I will add the link to the chat. There was an interesting article that came out in an MMWR last week that talks about high contact surface objects and their propensity to transmit monkeypox. Interestingly, the article reported that there were a lot of positive PCR tests. So that means that they're detecting the presence of the virus in homes of people with monkeypox. But interestingly, when they tried to culture monkeypox from those samples, they were unable to do it, which likely means that that viral RNA was dead when it was detected, which means that it wouldn't have been able to infect anybody, even though it was detected. So what that means is either the virus dies quickly or that routine cleaning methods are effective. Additional research needs to be done to either confirm both of those things or to generate an alternative hypothesis. But the good news about that is that it either dies quickly or cleaning methods are effective, which means that we do have tools in our toolbox that we can use to make sure that we're protecting those in our home if there is a monkeypox infection in the home.
Wonderful. Keely, thank you so much for giving us an overview on monkeypox and some of the new trends that we're seeing. Keely mentioned what MMWR, and I just want to spell that out. That's Morbidity and Mortality Weekly. So it's a weekly report that's put out by the CDC that has wonderful information. And we're so glad that you brought, that you shared that with us. We have one more announcement that we don't want to miss. Dr. Wolford.
Thank you so much, Evelyn. So very quickly, as I've said, in every week so far for the last few weeks, September 30th is our symposium. Please register for it. This registration is open now. And please go online and submit your nominations for award winners. So the award nomination site is open until the end of the month. So that is Wednesday at 11:59. It will close. So please go on before that. You have a few days to go on there and suggest people that you think are making a difference with information, with whatever they are doing in Flint to improve the health of Flint residents. Please go on and nominate for early career awards for academics and the community, for champion awards for the academics and community, and for partnerships. All right, Evelyn, thank you.
Wonderful, thank you. All right, it's been a wonderful hour to get to spend with you all. Don't forget, CHWs are wonderful community health workers and social workers. You can apply for those continuing education units. So make sure that you do that. And we look forward to seeing you next week. Don't forget, you can please like us on Facebook, subscribe to the YouTube channel. You can see all of our archived videos there. Email us if you have any questions at info@hfrcc.org, or you can always give us a call at 810-835-2130. And we will see you next week for week 129.